Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. I just wanted to talk to everybody today about sacroiliac joint pain and how to treat and resolve it with dry needling and joint manipulation, right? So in general, dry needling and joint manipulation are the two most powerful tools that physical therapists have at their disposal to significantly and rapidly depress sympathetic autonomic hyperactivity, elevate parasympathetic autonomic hyperactivity, and induce autonomic nervous system homeostasis, right? So one of the important things to think about as far as the pelvic floor goes is that the pelvic floor muscles are all innervated to some degree or other, right, by S2 to S4, which is the sacral plexus. And the sacral plexus is a parasympathetic dominant portion of the spinal column. So as far as an area to specifically target the parasympathetic autonomic nervous system. So remember, the sympathetic and the parasympathetic autonomic nervous system are on like a seesaw, right? So the more the sympathetics go up, the more the parasympathetics get depressed. So the areas of the body that are going to experience the most inhibition and dysfunction secondary to chronic sympathetic hyperactivity, which almost all humans are living with, are the areas that are the most parasympathetic dominant. That's just how it works, right? If your ligament is like this, you're in trouble, by the way. So as far as SI joint pain goes, you guys, there's a couple of things as far as manipulation goes that I think a lot of people waste a lot of time on. So if we're looking at the pelvis like this, right? So the sacrum is a wedge. It's like the top of an arch. It's very, very stable. So it is possible for the ilium to rotate posterior, and it is possible for the ilium to rotate externally on the sacrum, but it's not common, right? That's typically going to happen in like a car accident, or if you step in a hole that you don't think is there. Mechanically speaking, it's much, much easier for the ilium to rotate anteriorly and or medially. So what I see a lot of the time is anterior and medial on one side, anterior and medial on one side, and medial on the other side, or it can just be a combination of all of those things, right? So mechanically speaking, it's much, much easier for the ilium to go out of place into anterior rotation, right? So what happens with the pelvis is if the pelvis goes into anterior rotation, the acetabulum gets dropped down towards the floor and it makes your leg look longer, right? So you guys can check out my leg length video on this. It's one of my big pet peeves, but if you get people that think they have a leg length discrepancy and they haven't broken a growth plate when they're growing, if they don't have some type of significant hip pathology like leg calf Perthes disease or something, or barring some type of failed surgery where the joints didn't get placed properly, right? Nobody's going to have a significant leg length discrepancy. It's going to be a discrepancy in the position of the ilium in rotation to the sacrum, in relation to the sacrum, right? So as far as that goes, dry needling is such a fantastic way to treat and resolve SI joint pain for a number of reasons. So number one, dry needling it's the only direct treatment of muscles that we have anywhere in the body, right? So everything else you have to push through the skin. On the pelvis, we have some of the deepest muscles and the biggest muscles in the body, right? So the obturator internus is a big one that goes from the femur, wraps around the ischial tuberosity and attaches through the obturator foramen up there. We have the psoas major, which is starting on the lesser trochanter of the femur, kind of going like my hand and my arm, and it's attaching on the anterior lateral portion of the lumbar vertebral bodies, right? And we have the multifidus, which is the deepest muscle in the back, and that muscle, along with the psoas major, are the two closest muscles that we can get to the sympathetic chain. So remember, the sympathetic chain is sitting just like my two fingers here, right? So the sympathetic chain is our sympathetic autonomic nervous system. That's sitting on the anterior lateral portion of the vertebrae, and most books say that the sympathetic autonomic nervous system is from the stellate ganglion at the first rib down to somewhere in the lumbar spine, right? So by directly treating muscles like the multifidus, the QL, the transverse abdominis, right, the lats, all of these muscles that we cannot treat directly without needling become very, very easy to treat with needling, right? So the deeper the muscle is in the body, the more likely it is to not respond to typical treatment, especially in chronic situations, you guys. So I really think that muscles like the multifidus, which gets infiltrated with adipose tissue, It can get infiltrated like up to 50% with adipose tissue, right? When that happens, the multifidus completely loses its ability to contract and relax and provide the dynamic stability of the spine. And remember, the multifidus is a slow twitch muscle which is meant to be working all day. When that gets infiltrated with fat, it stops functioning, and the bigger muscles like the lat and the traps and those the paraspinals and other muscles try to take over, and those are fast twitch muscles, so they get tight, hypoxic, they get pissed off, and the whole spine just gets crushed, right? So by needling directly into ligaments like the posterior superior sacroiliac ligament, the sacrotuberous ligament, you can directly treat the piriformis, which is on average about 3 inches through the glute max on most adults, male and female. So again, these deep muscles that are in the pelvic floor and the sacral area, you basically cannot get any type of good treatment on them unless you're using a needle, because it's the only direct treatment for muscles that we have, right? So aside from needling the pelvic area, make sure to remember to treat the rest of the body. So the proper way to think about treating the entire body, in my opinion at least, is that, okay, so the act of living causes sympathetic autonomic hyperactivity, right? So mental stress, strain, and trauma cause sympathetic autonomic nervous system hyperactivity. The more the sympathetics go up, the more the parasympathetics get inhibited. So don't forget, or don't fail to realize that just because the person's presenting with SI joint pain in the clinic, that doesn't necessarily mean that the SI area is the problem. It just may mean that the person's sympathetic nervous system has become hyperactive to the point where the autonomic nervous system has lost the ability to self-regulate the body, right? So again, the areas that we're going to notice this the most in are the most parasympathetic dominant areas, which just so happen to include the pelvic floor, right? This is why it's also important to very, very important to include jaw treatment for pelvic floor treatment, right? Because the jaw and the pelvic floor, along with the upper cervical spine, are all parasympathetic dominant areas. We have the trigeminal cervical complex, which I really like to target at the otic ganglion through the little fossa here, right? The trigeminal cervical complex becomes hyperactive when the sympathetics goes up. That leads to areas that are connected to the trigeminal cervical complex, like the locus coeruleus, which is the brain's primary epinephrine producer, right? That starts producing way too much epinephrine. That makes us anxious, it makes us depressed, right? It causes all sorts of problems. So aside from just treating the pelvic floor, make sure you address the other parasympathetic dominant portions of the body, being the auricular branch of the vagus nerve in the ear, the upper cervical spine, and also treat any other areas of tissue pathology in the body that you can find. You guys will have really, really great results with this. And you can help people that have not had any type of positive response to physical therapy. If they haven't been needled or haven't been needled correctly, you do these treatments and it's a life-changing thing for them. Thanks everybody. Remember to check us out at intricateartseminars.com. We also have an online course and we have a second online course coming, so keep your eyes open for that. Thanks.